we're talking about some syndromes, okay, as related to pediatrics, you know. So we're talking about what's known as the Sandifer syndrome, and we'll also talk about what is known as the Grisel syndrome. Okay, Sandifer syndrome, then the Grisel syndrome. So what we have is we'll discuss the two of them different. Do you understand? So the Sandifer syndrome, you can see a 4-month-old child presents with abnormal posturing, there's dystonia, okay, pneumonia, EEG findings were normal though. So what's the Sandifer syndrome? So the two of okay, let's have an introduction to the two of them. So two of them is the Sandifer is a pediatric condition. Condition in what? Children. Okay. So it's usually linked to gastroesophageal reflux, you know, and abnormal posturing and spasms. It's usually caused by the gastroesophageal reflux. So the Grisel syndrome now is usually what traumatic what atlantoaxial okay, instability of the first two cervical vertebrae. The vertebrae are inside the neck. That's the C1 and the C2. They are not good. So have this. All right, so fine, let's talk. So Sandifer syndrome is a movement disorder in infants and young children. It's characterized by what paroxysmal dystonia, abnormal muscle contraction, and what opistotonic position. You ache the back and the neck. Opistotonus. You see that in people that also have tetanus, okay, caused by seizures. So, causes is strongly associated with gastroesophageal reflux, with hiatal hernia. Okay, so there's an opening in your chest where acid from the stomach is moving back into the throat. Yes. For adults, it might not cause this, but for children, they are fragile, so it might cause some crazy things. So symptoms is with a sudden arcing of the neck and the back. The limbs are fine. Episodes often occur after feeding, so may be mistaken for seizures. But you check in such a child, you still see gastroesophageal reflux. So you know that what is actually Sandifer syndrome. Diagnosis is clinical history, exclusion of you exclude epilepsy. You know. So if you manage the gastroesophageal reflux, the baby becomes fine. Okay, so fine. Let's move to the next, which is Grisel syndrome. I wonder why I'm discussing the two of them together. They're not even related. Well, I was reading about some things and I saw the two of them together. So I just said, well, let me just discuss the two of them together. So Grisel syndrome is issues in the C1. You have, your vertebrae here, C1, you have the C2. So issues between these guys. Okay. So there's an instability between the C1 and the C2. So it's often follows upper respiratory tract infections, tonsillectomy, adenoidectomy. Well, all of them is respiratory system and gastrointestinal, so it's kind of like related. So symptoms is painful torticollis. Your neck is twisted to the side. This girl is not posing for the picture. Her neck is twisted permanently like this. Yeah, okay. So there's limited neck movement, neck stiffness, and muscle spasm. There's neurological complications if it becomes severe. So that's what we got. So clinical examination plus imaging. So we got. So treatment is what? Rest, antibiotics, anti-inflammatory drugs, cervical collar. If it is persistent, you do traction or surgical stabilization. Prognosis is good if you diagnose this early enough. Okay. So that's what we have for the Sandifer syndrome and the Grisel syndrome.